Morning, everyone. We'll just give everyone a second or two to join. Thank you. So, morning, everyone. Thanks so much for joining. I know it's early and it's nice and chilled here in Gauteng. Not sure where everyone's joining from, but it is nice and chilly here. Please, just some housekeeping, please make use of the Q&A function, as well as the chat box if you have any comments as we go through the proceedings today. But the Q&A function is definitely the better option in terms of asking questions. But towards the end of today's presentation, we will open the floor for comments and questions. So there will be an opportunity to engage. So once again, thanks for joining us. Today is the 11th birthday of Rare Diseases South Africa. And we thought that today would be a great opportunity to share the changes that we have made on our side and to walk everybody through a little bit of our strategy, to understand really what our intention is, and also to introduce our Rare Disease Partnership Program, which really is going to be the future path to engagement and partnership at Rare Diseases South Africa. So we hope that you enjoy it. I just want to make sure that anybody can hear me, because I have two options coming through on my Zoom. One says that I'm unmuted, the other says that I'm not. I'm going to try do this. Maybe it works. I think I might have been speaking to myself. If there is something in the chat. Oh, no, we can hear. All right, perfect. Thanks. Okay, so right, I'm going to kick off then, if that is okay. So just a little bit about Rare Diseases South Africa. At Rare Diseases, we don't just dream of a world where patients are impacted, patients impacted by rare diseases are just simply recognized and counted. I think that that's a great starting point. But essentially, we want to bring the necessary support to ensure that they experience greater recognition, support, improved health services, and better overall quality of life. And I stress the importance of overall quality of life, because there's this perception that in the rare disease space, that sometimes, we can't necessarily do more for these patients, or because we can't treat them, then all of a sudden there's nothing that can be done for them. And that's not always entirely correct. There is always something that can be done to improve the quality of life for these patients. So it's an imperative, it's a driving force for us. That's really one of the things that we focus on quite significantly in our day-to-day. Right. If anybody can just give me an indication, please, that my screen is still sharing and that you can see it correctly. That'd be great, because I'm adminning this morning on my own because it's so early. Okay, perfect. Thanks, Erica. All right. So, right, a little bit of background to rare diseases, and I will skim through this because of the fact that obviously I think many of you do know who we are and what we do. But we are essentially a nonprofit organization advocating to ensure people living with rare diseases are recognized. And statistics indicate that 1 in 15 South Africans are impacted. So despite this, our rare disease community are severely underrepresented and remain vulnerable from both a medical and a policy perspective. 1 in 15, that's 1 in every rugby team, right? And yet that equates back to about 4.3 million South Africans. And yet we find ourselves in a position where we're still not deemed to be a priority. And largely, I think, because of the fact that we are are an expensive cohort to treat where treatments are available. And I think because of the fact that we're complex, the kind of approach has been maybe if we, just ignore them, they'll go away. But the reality is that we're not going anywhere. And as Rare Diseases South Africa, we bring together international best practice and local medical innovation, driving a collective voice and playing a fundamental role in essentially trying to bridge the gap between vulnerable communities and medical advancement. So a little bit of an overview. Our principles include equality, care, dignity, and empowerment. And I think that those are 4 very important principles when dealing with anybody that is impacted in healthcare. Our vision is a South Africa where those impacted by rare diseases and congenital disorders access life-saving treatment and supportive care for improved quality of life. And our mission is bridging the gap to improve quality of life for those impacted by rare diseases and congenital disorders through advocacy and empowerment. So our 4 key focus areas, what do? We advocate, we navigate, we engage, and we research. And our advocacy is, the definition is publicly recommend or support. And it's around representing patients with regards to policy, healthcare costs, and delivery. So essentially, that's making sure that they actually have ability to be able to access interventions, that when they arrive at a hospital, that someone is there to assist them, that they get heard, that their needs are met, that there are services there for them. Then navigation is to plan and direct the course. And that is really our guiding patients from presentations of symptoms right through to end-of-life care. And this includes things like referrals to centers of excellence, ensuring that patients are able to access diagnostic services in a timely manner, that they're actually able to get to the clinics that they need to be at. Our engagement is around participation or becoming involved. And this is really where we ensure that our patients feel supported throughout their journey by providing them with awareness platforms and peer-to-peer support. And this is such a critical element of what we do. Every single day, we support over 1,000 patients on our online chat groups. 1,000, and I kid you not, it's like 1,000 messages a day. We have patients in over 80 groups that are participating in those groups. And it really just gives them an opportunity to be able to vent, go through what it is that they're feeling, ask questions, get guidance from other people impacted by the same conditions as them. And then lastly, research. And research is essentially providing an evidence-based foundation to underpin our advocacy work. So it's making sure that whatever we're driving in advocacy, we have the necessary data and support to be able to support those statements that we make. So who we serve, our patients are essentially the center of everything that we do, and they are immediately supported by their caregivers and family members, as well as our patient voices ambassadors who provide a support membrane, ensuring that our internal patient community has access to relative peer-to-peer support and information, and being the filter for us as Rare Diseases South Africa in terms of communication and messaging. So those are the people that we serve. And when we make decisions, we make the decisions to the benefit of that community. Then we have the people that we engage. And we engage with a broad variety of stakeholders in our day-to-day work. And this includes academics, researchers, faith-based organizations, other patient advocacy group, policymakers, regulators, government, health service providers, etc., etc. And who supports us? Well, we are essentially supported by donors, volunteers, and our rare activists. So our rare activists are members of the public who use their mobility to benefit those without it by running, swimming, and cycling and raising funds for us through that. Obviously, donors, we have both corporate, individual, and foundations, and then volunteers who provide skills and services as well as time. So what are our organizational goals? And these are the things now in our 11th year, so it's really time to put on our big girl panties, so to speak. And, what do we want to do going forward? What have we learned over the last decade of our existence? Where do we know we need to improve? What do we need to change? So the one thing is expanding our engagement. Whilst we think we've been really, really good with engaging with our internal community, we know that our external communications are often lacking and inconsistent. And we really want to actively engage stakeholders through focus groups, surveys, direct interactions to understand the needs and the concerns and the expectations from their perspective. So this is people that were in the outer circle, and it isn't necessarily, it's about understanding what they're needing from the healthcare system, so that we know that we need to advocate for that as well. We bring the patient voice into everything we do, but we're still working in a multi-sectoral environment. And as a result of that, it's imperative that we understand the needs of those that are working around us as well to rectify these issues. We then also have a need to increase our capacity, and this is really our internal capacity. And this is so that we can realize our mission and purpose through a multifaceted approach. And, effectively, we want to be able to advocate, support, and improve health outcomes for our communities. But we actually need, staff, people that are trained. We need services, etc., in place for us to be able to do that. So it's very easy to say we're supporting 1,000 patients online every day. We need people to monitor those messages to be able to provide a response. We're needing someone to answer the phones, answer the emails, etc. So that really revolves around increased capacity. And then obviously there's a massive need for us to improve our sustainability. And we are making a concerted effort to ensure that we diversify our funding streams so that we can maintain our autonomy and independence, which are crucial for us to be able to do what we need to do and to do it well. So expanding engagement. We're hoping to do this, obviously, and this is what this partnership platform is really around, engaging commercial companies and pharma and industry members. But we're obviously looking at expanding engagement in a variety of other sectors as well, with all those other groups that I originally referred to. And we're really wanting to, seek feedback. We're wanting to understand the challenges, because it is so imperative for us to get it. I think we've done a lot in terms of understanding the needs of medical schemes, understanding the challenges from a funding perspective, but there's a lot more that needs to be done. Please excuse Miss Lola Jane, who's, I think, barking at the doggy down the road. We also really want to foster partnerships with other organizations and healthcare providers, as well as government agencies, so that we can leverage resources and expertise. We've always taken the approach that to do things together in a collaborative way is the right way. If there is someone else that's already doing it, there's no point reinventing the wheel. And I just end with a quote there that says, the best way to minimize disagreement is to make sure that all the stakeholders are in the room. And that really is what we're about. We want to get everybody together and provide opportunities for us to break down those barriers. And I think anybody who attended our REREX conference that took place in February would have seen that in action. It's about bringing people together and giving them the opportunity in a safe space to really say what it is that, is on their mind. Then we come to increasing capacity. And I spoke about us needing to increase our internal capacity. But, by doing that, we can invest and retain our core team members. To train people in this space is not always easy. This isn't something that you can just walk into. Often we're needing people who've gone through this and have experienced it, who actually have the insight to be able to support our patients better. And we want to be able to retain those staff members. We want to be able to ensure our staff are motivated and committed to delivering high quality service, and that they're earning market related salaries. And that's really, really important to us, because we have lives at the end of everything that we do. We don't want to have delayed response times, etc. But we also battle with compassion fatigue in this space. The stories that we engage with and the people that we engage with every single day are going through some really, really tough things. So it's imperative for us to be able to support our staff appropriately. We would like to be able to streamline our operations and optimize our resource allocation and improve our partnerships with stakeholders. And then with regards to improved sustainability, Rare Diseases South Africa really wants to maintain its independence. We had always set ourselves the goal that it would be split 1/3, 1/3, 1/3. So we wanted 1/3 from our membership, but it's imperative to remember that a big part of our membership remains our patients, and we don't feel it's fair to ask them for funds. They are already cash strapped and battling to access services, etc. So we have diversified our membership options. We do have corporate members, academia, healthcare professionals, etc., to try bring up that membership balance. Then we also focused on 1/3 coming in from companies, including industry partners such as pharma, and then 1/3 coming from fundraising and events, etc., etc. And that is like our rare activists. But what essentially happened, and we were doing quite well prior to COVID. So our first couple of years, we were doing okay. We always did manage to ensure that our industry funding was less than 50%. It's not 33% that we wanted, but it gave us we were able to keep it under 50%. And our events fundraising used to do really, really well. Throughout the year, we would raise over R1 million on average, doing our running, swimming, and cycling, etc. And our member contributions were still quite low. And the risks there were that we still had a heavy reliance on industry, which we don't want. We wanting partnerships with industry, not reliance. Our events and fundraising require a heavy workload. It's a lot of work. It places staffs at risk in terms of burnout. And our members are not invested in the outcome of the organization if they're not actively participating in the organization. So having a very, very low membership base or contributing members means that not everybody is actively, that's saying you've got to have something in it, you've got to have skin in the game. So then during the COVID time, 2020 to 2023, obviously events and fundraising could not happen. So we couldn't gather, we couldn't hold any of those events. So our fundraising reduced significantly. I think percentage-wise, it was like 120% or something from the 1.3 million that it used to be, right down to 185,000. And that's because most of us spent our lockdown cycling on an indoor trainer at home. Our membership fees also reduced quite significantly, and that was to be expected. I think everyone from a personal perspective was going through some really hard times. Our industry funding dropped as well, but there was a shift in how industry participated. So previously, we would get unrestricted grants, which would allow us some flexibility in terms of how we could utilize those donations. But during COVID, we found that industry support shifted to being more project-orientated funding, whereby we had, it was for a set time with set objectives, which means we now ran into a significant budget deficit over those 3 years that we weren't able to cover because of the fact that we were now focusing very much on projects. So that means when we're doing project funding, we're focusing on a specific set of patients. So you might be focusing on patients with a specific lung condition or, epilepsy, etc. But by doing that, we then don't have funding available to be able to support the rest of the patients who don't necessarily have commercial entities looking to there might be untreated patients. There might be patients who are still undiagnosed. There might be no treatments available for them at all. So those patients then get left out. And again, we have a massive reliance on industry. We significantly having to cut back on project staffing and services. And we have mission creep because now we're taking on a whole bunch of projects and we're pivoting and diversifying, but we still have our core 4 areas that we're needing to maintain. So that mission creep sets in. So how we're planning on doing this going forward is that we're hoping that we can get back to that, 3-way split distribution. And the benefit for that will be consistent engagements, invested member community, and obviously improved compliance. So who are the lives we touch every day? So we have at the moment just over 6,300 patients and caregivers. We have 4.3 million people in the country, so we're missing millions. But from a sustainability perspective and a scalability perspective, we are bursting out of our seams and we are not able to onboard new patients at the moment because we simply don't have the services in place and the sustainability and the structures in place to be able to support them correctly. We manage day-to-day 83 disease-specific online support groups, and we are also supported by our 71 patient voice ambassadors. We really are bursting at the seams. This is our team. So we are sitting with 4 full-time staff members in myself, Mila, Ankia, Nomsa, sorry, 5, and Sumaya. And we have 2 lovely interns in the sense of Mataboho and Millicent. We have 2 consultants, Kerry and Helen, and then we have Jen, who is a volunteer. And that is the entire extent of our team. So when people think we have thousands of people working for us, we really don't. And our monthly impact. So we've done it over, I went and I evaluated 6 months, and this is on average. So our full-time support staff of 5 supports approximately 1,050 patients each. So if you take our 6,300 patients support group, support base at the moment, you divide it by the amount of full-time staff members, and that's essentially what our customer base is per month. So as you can imagine, it is a ton. The reason I've only done it with the full-time staff allocation is because our interns fluctuate, and they come and, they obviously come in and go. It's a government program that we partnered with. And as a result, we're not really able to rely on them for the high value items, which like patient engagement. So while they can assist us with administration, etc., the servicing of these patients really remains the responsibility of us full-time staff. An average cost of 59 Rand per patient per month. So for us to be able to provide them with services, and that is, providing the navigation, providing the advocacy support, providing the referral to genetic and psychosocial counseling, to be able to answer their queries, pick up on their needs, it costs us on average of 59 Rand per patient per month. We've worked out based on generic sales data, knowing what we know from our claims processes that we help facilitate. And this is literally just on drug. It's on treatments and minor interventions. It's not for things like auxiliary therapies, etc., etc. Very often they are not quantified. We estimate our economic value from the work that we do to be about 83 million Rand in pharmaceutical sales every single month. So I think we do, for a small team, for a small lean team, I really do think we do pack a punch in terms of impact. We have approximately 50 new patients that register with us every single month. We have 1,200 doctors that sit on our membership base that we support as well with answering questions, connecting them to other HCPs, making sure that there's a network available for them. We review approximately 60 funding decisions in a month. We facilitate 30 new diagnostic tests and referrals for diagnostic support. We attend approximately 80 meetings between us. We participate in an average of 2 conferences every month with 3 speaking engagements. We engage and educate about 60,000 people through our digital media, and we have to fundraise on average 375,000 Rand per month. So we're busy. In terms of our 4 key pillars, and I'm not going to go through this, these slides will be available. I just wanted to show the 4 different pillars, what sort of activities that we are, participating in, and what sort of programs, etc. And this is our base. This isn't the nice and fancy stuff. It's not developing nice new educational materials for a specific disease area, or having a webinar, or hosting a key opinion leader. This is the basic stuff. This is the stuff that we've committed to do, the participation that we've signed up for, that we have to get through on a month-to-month basis. So what are the challenges still for our patient community? We still have low priority in terms of national health. We still have diagnostic issues. We still have lack of access to reliable information, limited treatment options, all those things which I think everybody is aware of. But these are where the opportunity for partnerships and collaborations come in, because these are the things that impact everyone that works in our wider stakeholder grouping. This is not just a patient community, but all of these things have impact outside of that as well. What are our current challenges with our current method of industry engagement? Well, if I can walk you through the process, how industry engagement started initially was we were a small budding group, And, we would just engage industry members as they found us or as we found them. And that communication would be very, very ad hoc, and it would be very inconsistent. And some companies would get more value with engaging with us than others would, simply because of the fact that, it was driven by, communication and what the needs were at the time. So transparency has always been difficult up until this point. We have limited unrestricted funding or commitments to the overall objective. So we find that a lot of industry partners come to us with a very specific issue that they're trying to resolve, but they don't necessarily buy into the rare disease cause in the long term. Sustainability, we have long-term projects that are not prioritized because most of our grant cycles and the grant funding, et cetera, that does come through is limited to a year, which is problematic for us because we don't only plan on doing this work 1 year at a time. We've been doing it now 11 years, and we would like to continue to do that. We have an inability to engage all partners equally because of how it has been set out in the past. So there's varying benefits to industry. Our autonomy and independence becomes vulnerable. Compliance becomes an issue. Mutual respect is a massive thing, and conflict of interest and competing interests. So often we're engaging with more than one company working in the same space. So we've adopted a new policy, and this is essentially what we're trying to bring you all here today for, is to understand this new policy. So we believe it's essential to establish some transparent rules about the financial support we get from commercial companies. We want to ensure that these are appropriately recorded, and that any financial transactions that take place are done in a transparent manner. We did just make the distinction here between donations, grants, and sponsorships because every company has their own internal policy and own internal language. So for us, donations are not as a result of a competitive grant proposal. They have no advertising opportunities. They typically are solicited annually, so we send out an annual request, and they are applicable for BEE scorecards and tax benefits. Where a dedicated grant, often pharma uses that as a this is from our perspective, it has a limited time period and specific activities. So there's clear defined objectives, and sponsorships are things like sponsoring a conference, etc. And it is usually in exchange for marketing. So the patient numbers, and this is where it becomes important, I think, because when we engage with industry, often it is around the bottom rung, the treated patients. That's where the commercial interest lies, because that's obviously where treatments are being manufactured, et cetera, et cetera. But we still have diagnosed patients who are not on treatment that we support. We have patients that we know are going to be diagnosed with the rare disease, but are still in the diagnostic phase that we are supporting. We have patients who are symptomatic and are far down the line that we're needing to support. And all of those upstream patients essentially are the patients that you will be approaching us 4 or 5 years from now when you've developed new treatments. So it's imperative for us that we continue to support them and ensure that they have access to information, that they know where to find us, and that we can find them. So when new treatments do become available, that we can go out and say, right, 5 years ago, this condition had no treatment, but now we have something available. Let's see who we can get on treatments, and let's see who qualifies, et cetera, et cetera. So it's imperative for us to be able to support the entire patient community, not only the ones where there's a commercial interest. And that, I think, is where our problem has been over the last couple of years since COVID, when the change of funding kicked in, because now all of a sudden there was a lot of interest around commercial activities, but we still trying to fit the bill for the larger patient community. And often the larger patient community are the ones that are the most requiring of resources. The treated patients, once they are on treatment, it's just a case of supporting them. But in those initial phases, when they are looking for information, when they're looking to be referred, when they're trying to get a diagnosis, when they are backwards and forwards to the hospitals, et cetera, for testing, et cetera, that's when those patients require the most support. And that's the area that's funded the least. So our Rare Disease Partnership Program is essentially what the aim is to establish a long-term educational relationship between rare diseases and commercial companies that have products and services that impact our patient population. And we aim to develop a platform for companies to support the rare disease cause and to increase mutual understanding of issues that are of importance to both sides. The objectives is to build a cross-industry network of companies working in areas that affect rare disease patients that are clear and transparent and everyone can know who they are, to exchange perspectives on issues that are vital to industry and rare disease patients, and to stimulate companies across many industries to address the patient needs. It's, we want everybody to understand what the journey of these patients are, what the process is for them from the beginning, not only when it comes to a commercial treatment. So membership takes the form of an unrestricted annual contribution, which will be determined by Rare Diseases South Africa on an annual basis towards advancing our mission of Rare Diseases South Africa. The annual contribution for this year is going to be 80,000 Rand. We have done some research around what other industry partners, etc., other patient advocacy groups are doing, and this seems to be a relatively fair representation. We are needing members to acknowledge that there will be a code of conduct and that there is a request, that there's a requirement that you attend at least 2 meetings per year in this forum. It doesn't help if we have partnerships, but the partnership, one side of the partnership's doing more than the other. So it's imperative that this is a two-way thing. Members will also be able to engage Rare Diseases South Africa on other projects. So for instance, if you're still wanting to do your educational materials, your webinars, your key opinion leaders, etc., you will be able to do that with us, and we will still continue to partner on those projects. But we are needing the support for the greater scheme of things first before we can focus on those things. And also anybody that signs up for this membership will also be acknowledged in our annual report as well as the funding section of our website. So what will the benefits be to Rare Diseases South Africa? Well, firstly, it will provide us with pooled financial support for unrestricted funding so that we can actually do the work that we intend to do. It'll assist us in supporting all patients, including the undiagnosed and untreated. It'll allow us to focus on our key objectives, which we do feel are worthy of support. Engagement with commercial companies will be based on principles of partnership. There'll be improved transparency and compliance, improved sustainability, and it's an opportunity for us to build organizational capacity. So essentially, the growth of funding in this manner will expand our reach and deepen our impact and empower more patients. And then what will the benefit be to commercial companies? Well, compliance. Companies will be able to demonstrate a commitment to ethical practices and compliance within industry standards. It'll also enhance credibility within the patient community because the community will be able to see that there is a general support, to the greater cause. Transparency. Fees will be transparent. Everybody will be able to know who we're engaging with. It won't be, all the communication will take place in an open forum. You will know that you are improving sustainability and that you are providing sustainability to our patient, pipeline, essentially, and benefits to patients. You will be directly benefiting the patient community, and your support will enable us to continue providing the essential services and support that they need for those living with rare diseases. So now I'm going to open the floor. It's your turn. And I look forward to hearing from what comments are. And please, this is a dialogue. I would like to know, what industry's feeling is around this issue. Do they think that this is a workable solution? Do we feel that, can you guys see our point in terms of being able to support the greater community as well, and not only the ones that are on treatment, et cetera, et cetera. So looking forward to hearing from you. So you can either raise your hands, you can pop a chat into the chat function. Alternatively, I'll just start picking people out of the crowd because it's our birthday and, essentially this is our party and we can do what we want. So just going to try and see what's happening here. Right. The last person to make a comment here was David. So I'm going to actually, I'm going to give you an opportunity to talk if you would like to. David, Coral, Cornet, I'm going to just pick you guys out. Derek, anyone, please provide us with comments. It's imperative that we understand, if this is what industry's view is on these things. Okay, Cornet, thanks. You should be allowed to unmute now.
Morning, Kelly, thank you for picking on me. I really think, not all companies involved in this space necessarily have all the expertise in this space. So from an organizational perspective, I really think partnering with rare diseases makes our voice larger in a compliant manner and teach us a lot about patients. Pharmaceutical companies traditionally have all the knowledge about the treatment of the disease, but due to various aspects, legislations, aspects, it's not always easy for us to hear the voice of the patient. And I think rare diseases has really partnered and has delivered throughout the last couple of years to put us in touch with our patients. So I can't commit yet. That's not my call. But yeah, thank you for the work that you're doing. And I really think by all taking hands, we benefit the patient.
Thanks, Cornelia. I think you raised a very, very interesting point in terms of size. So I think that's, and when I was referring to, us not being able to give everyone the same amount of attention, that is what it comes down to. Often we do have some companies that only have one treatment and they're tiny in comparison to some of the other global multinationals. And we want to be able to, the patients that receive those treatments from the smaller companies are just as important to us as the ones that receive them from the larger companies. And that's why, so I think, thanks for that comment, because it's a reminder that this will hopefully level the playing field to some extent in terms of who can participate. It's not about how big you are, how many molecules you have. It gives all of us an opportunity to learn from each other. Also, I think big benefit to the smaller groups as well, who will be able to get insights from how things have been done historically by the bigger groups and learn from those insights. So thanks very, very much. I appreciate that. Right, Coral, I'm going to open you up for talking because you were the next on the list.
Perfect. No, thanks, Kelly. I agree with the comments. I think it's a great initiative and a great way to stay close to the patients. I think one thing that is on top of mind now is just the NHI aspect and how that will change the landscape and how rare diseases plan to stay committed throughout this and throughout our NHI. And what do you see as the future of rare diseases with the NHI landscape?
Yeah. And I think that also is a really, really good point. I mean, I think our advocacy component is about to have to, it's going to take off because we're going to, certainly for the next, I would imagine the next decade, we're going to be functioning in a almost 3-tiered system where we're going to still have private medical scheme, have the introduction of NHI for certain services, and then we're going to be sitting with, still dealing with state services for the rest. And we're going to have to, this is why upskilling now is going to become so imperative. We want to be able to upskill on things like health technology assessment. We want to be able to, incorporate feedback into those processes, etc. But we require the capacity to be able to do that. And the reality is our team of 6 people are not going to be able to navigate us through NHI. We need to onboard staff. We need to upskill and capacitate now so that we're prepared for those engagements when they come. Even over the last sort of 5 years from when the white paper was published to now, we've seen initially we were assured by Anban Pillay that rare diseases would be covered and they would have a space. Now it's like, oh no, we're not quite sure what that space is going to look like. I mean, you should get services eventually. We need to stay on top of the ball in that regard. So we wanting to be able to focus on advocacy. We don't want to be hustling every month for fundraising. We want to have sustainable funding so we can go out there and advocate. And I think that the challenge has been over the past couple of years is that we spend 1 week advocating, 1 week fundraising, 1 week engaging, 1 week fundraising. So, we want to be able to say, like, listen, we've got the funds to do this for the next 3 years, and we're going to go out there and we're going to smash it. And I have no doubt in our ability to be able to do that. I think the fact that we are continuously invited to engage on high-level platforms is an indication of the fact that we are a respected patient advocacy group. We work well with our government structures. I think we've moved around well politically, but we actually need time. Time and focus are the two critical things for us to be able to do the work that we'd like to do well. So yes, Tulani, I see your hand has gone up. I have allowed you to talk.
Hi, Kelly. Thanks for the opportunity. I'll allow Tinswalo to speak on our behalf.
Hi, Kelly.
Morning, Tinswalo.
Morning. So we decided as a team to sort of come together. So we're just dialing in from Tulani's laptop. But I think from our end really is to commend you for the work that you're doing. I think the strategy is pretty clear. And I think we've also, as we were going through your presentation, we realized, I think some areas obviously where we could collaborate, but I just wanted to find out from you, if you're looking at obviously some of the challenges within the policy space, right? Especially around, I know you've been working quite aggressively as well, and I think at RDSA it also came across quite strongly around the definition of rare diseases and trying to see how, because that will also sort of unlock other opportunities, right, within the rare diseases space, as well as, some of the barriers we've been facing. Is there any, thought process around how far that process is, or how you're collaborating with various stakeholders on that? And yeah, I think that's something that would also obviously look at supporting as we've also engaged in the past. But I just want to say the strategy is very clear. I think it's well thought out, and congratulations to you and the team for that. And we're obviously willing to still continue participating and collaborating with you as well.
Thanks very much, Tinswalo. So yes, this is one of the consistently applying the pressure is something that's required. So we've done a lot. We've managed to get the definition approved. So that's great. We've got a draft framework document, a policy that has been drafted that is in the engagements with stakeholders at the moment, with external stakeholders. We've met with the National Health Department now 3 times, and our recent meeting determined that there was a specific project that we needed to do in terms of quantifying the 4.3 million South Africans. Who are they? What do they look like? Where are they? Etc. So that's in process at the moment. So it's a continuous, we've got to continuously plug away at a few holes. And as you engage with stakeholders and they provide you with feedback, you realize, okay, this framework document needs to be bolstered here, or this isn't going to work, etc. And that's why those engagements become so important. But again, it comes back down to the resources to be able to drive that consistently. And, my whole, and I think I've been quite open when I've said this, administration is not my thing. Because I'm the founder of Rare Diseases South Africa, I've landed up, being in the CEO role, but advocacy is where my passion is. If I had the time and I didn't have to keep coming back to steer the ship, so to speak, I would be advocating all day long. Like, you wouldn't be able to keep me out of meetings, because that's really where my passion lies. I want to drive that policy. It's my dream to see South Africans get some form of recognition within our legal system. And that is quantifiable and accountable, that we can say to people, you've said that you're going to do this and you haven't done it, and why haven't you done it? That's ultimately what we want. I don't want a patient who's diagnosed at Baragwanath Hospital to receive less services than someone that's diagnosed at Charlotte. It's not equitable. We want to know that regardless, if you're a South African citizen, you are accepted, you are pulled into a system, and that you are given access to the services that you require. I do acknowledge we're never going to have a perfect system, and it's certainly not going to happen from the beginning. But if we can improve our access to the services that we receive year in on year, that in itself shows progress. And that's all we're wanting. We just want to make sure that we're not standing still, and we definitely want to make sure that we're not losing access to things that we've historically had. But in an ideal world, driving that advocacy is really what I want to do. That's where I want to be, but I can't do it in the existing challenges that we have, where I keep having to come back and reshift our focus, and we're having to take on projects that don't necessarily drive advocacy simply to keep the lights on. I just want to see, I don't see any other hands, but I did see a comment. Renette, I did see that she had to unfortunately step away. David's asking, could you please speak to the HGA components in your slides in a little more detail? What does RDSA envisage? Well, this is interesting, right? So what we understand at the moment from the health technology assessment space and the limited interaction that we've had with it is that HGA in the South African context at the moment is really just, it's often funding schemes, or it's pharma providing a pharmacoeconomic evaluation. It's not a full-blown HGA in the greatest sense of the word. And patient involvement in the HGA design process is going to be critical. We are in such a sweet spot at the moment in that there isn't an independent HGA process available, and there's a lot of talk about setting that up. I know government wants to retain it. I'm not sure that that's necessarily the right thing, but the fact is that we've got an opportunity to design a system now that works to the benefits of everybody, where patients can be involved and where you can get a comprehensive overview of HTA. There's tons of models that have happened overseas as well that are working really well. And I also, from my understanding from people like the African Medicines Agency as well, there's a willingness to collaborate on behalf of us as a continent, whereby we say, if we've done it for one area, that, we've focused on the unmet, unprioritized needs, we evaluate. So we take, say, 27 molecules or 25 molecules. We spend a couple of years evaluating those molecules, and then that is published and utilized across the board. That's something we'd love to be able to partner with and get involved with, but we need to be able to upskill. And to upskill, we need time. And time is not something that we seem to have much of at the moment because we're too busy running around like chickens without a head. So, David, yeah, that's really, we want to be able to work in that HGA space a lot more. And we do see that this is the opportunity to do it. There's a lot of talk about how that's going to be set up, and we're hoping that we can participate and get involved. Sorry, I've just seen another Q&A come through. Is this a model that is used elsewhere in the world? I presume you are referring to, because it's come up as anonymous, I presume you were referring to this entire RDPP, the Rare Disease Partnership Platform. And yes, absolutely it is. Certainly we've got some other companies in South Africa that do it as well, not companies, patient advocacy groups that do it. As an example, I know that the Prostate Foundation does something very, very similar. In the rare disease space, this approach has been what has been taken by all the international and national, regional rare disease patient advocacy groups really worldwide. So between Rare Diseases International, EURORDIS, NORD, Global Genes, everybody has a similar policy where you set up a membership structure specifically for commercial companies to be able to participate, so that, that box is really, really clear in terms of how we're participating, who's participating, how can you participate, and what the principles of those partnerships entail. So yes, it certainly is a model that has been adapted elsewhere. I am going back into the Q&A. What are the consequences of companies not joining this initiative? Great question. So I think from our perspective, we are in a position at the moment, and I'm being completely honest, is that we are burnt out and worked out to the point that we've decided if we can't get it to change, we'd rather not do it. If we can't support these patients sustainably and ensure that everybody has the opportunity to have their phone call answered and their query answered, etc., we don't want to be letting patients down. So we have to draw a line in the sand. And that line will be, going forward, companies who haven't participated or who intend not to join won't be able to engage with us on other partnerships. And the reason for that is that that's always been the more the easiest thing for them to do. And that is what has happened over the last couple of years through COVID, is that we see partnerships that are really not really partnerships. It's more, we have a specific need and we want you to assist us in getting that need. And then once we've got it, we disappear into the ether and you don't hear from us again. And that really doesn't work for our patient community. So if companies don't participate, they will not be able to partner with us on other projects. We are open to negotiation if it comes down to the rates, if it comes down to the principles of the partnership, etc. And that's essentially what we're trying to get here. We're trying to get a feel for what are the concerns, if there are any. But yeah, and we at the point, and this has been something that has been established. We've had this discussion now for quite some time, and the policy entails, the policy that has now been adopted entails that you have to have bought into the greater support of supporting rare diseases in their entirety before you can focus on your own commercial interests. So a little bit nerve-wracking for me, I think. But yeah, that's just how it has to be at the moment. Okay, not seeing any more Q&As. Are there any more hands raised or any other questions? Trying to see if I can find anybody else that I can pick on. Yeah, maybe Shivani, if you there, let me see, maybe you want to, I don't know, I'm trying to allow everyone the opportunity to talk if anybody has. But yeah, I'd be very, very interested to hear if there's any other comments from anyone. And really, this isn't us holding pharma hostage in any way or industry hostage in any way. It's about us trying to develop a more sustainable approach that benefits everyone, that the rights and responsibilities are clear for both sides for both parties, and that we have more consistent engagements and feedback. Right, I'm not seeing Prudence. I see you are online. Not sure if you want to add anything. Tulani, I see. I presume it's an old hand. I'm going to lower it. You're more than welcome to pop it back up if it isn't. Yeah, I just want to, if you can just indulge me for 1 second. I just want to check, because this is being streamed online. This is the worst, having to do both sides. If you can just give me 1 sec, I just want to see if there's any feedback that has come through from the online portion, which I absolutely cannot open for some reason. Yeah, no, I think all the comments there have been handled. Yes, the slides will be shared. So no worry there. We will be sharing all the slides with everyone that has been in attendance, and they will also be published on our website. And a copy of this recording will be made available as well, because that has been asked. Another anonymous question: does the partnership include any operational costs and patient support? How would you navigate the educational aspects that is important from an organizational point of view? Well, okay, I'm going to try and interpret the context of this question. So patient support, this is as an example, last year before last, we launched a high court matter against a medical scheme, and the legal bills for that's not something that industry can support, so that has to come out of our fundraising. Getting patients to treatments is also not something necessarily that industry can support. So those direct patient costs are where we are heavily reliant on our events and fundraising. But what has happened over the last couple of years, with obviously all the changing in funding streams, our events and fundraising, which was normally reserved for the use of direct patient support costs, etc., has now had to go into assisting us with operation costs. And that's not an ideal scenario for us. And to the point that last month was actually the first time that we've had to turn a patient away that needed assistance with transport. We had to actually send out a plea for support before we could assist her in getting her son to hospital, simply because our patient support fund has run completely dry. So yes, our budget does provide for patient support and direct patient support. What we don't do, we always, if we are providing patients with support, it's a very, very specific process that needs to be followed. We don't give cash back to patients for anything. We're always paying for services. So we'll pay for a doctor directly, we'll pay for transport directly, et cetera, et cetera. How would you navigate the educational aspects from an organizational point of view? I presume this is around, educating the public, et cetera, on rare diseases. And that forms part of our community engagement, and that is part of our essential pillars. So we do that, and that's one of the things we'll continue to do. For as long as we exist, we see that educational component is huge. We have there's a reliance on us to be able to educate the public, to be able to educate policymakers, etc., on the plight of our patients, and that remains our responsibility to do so. So we'll continue to do that as far as possible. I am just checking. When do you intend going live with the new way of engaging, Crystal? Our financial policy kicked in on the 1st of May, so it is already live, but we obviously understand that this is a bit of a teething period, but we are hoping we have already, actually, I can because it's transparent now. So I can tell you that Clinician, Equity Pharma, has been the first membership to sign up. So we have already got our first partner on board, but essentially this is our first level of engagement. I made a joke with someone the other day. I said this will be the last toll-free call. From now on, it's pay as you go. So it is live at the moment. So thanks for that question. And I think I've covered everyone. We are running towards the end of our time. So just in closing, just to say thanks so much to everyone for, just getting a little bit of insight in terms of what it is that we are wanting to do and focus on and how we plan on doing it. And really, we have an opportunity to build back stronger. This presents an opportunity to address a lot of the things that we thought we needed to do right from the beginning, that we didn't necessarily get in place. And I just hope that we can rely on the partners and the partnerships that we've had over all these years to engage with us in this new way of engaging. And we are hopeful that that we can build back stronger and that we come back more sustainable and able to focus on the things that matter. And that is largely our advocacy component. So if I can go back to doing full-time advocacy, I'll be the happiest person on earth. If anyone wants to give me that present for our birthday today, I'd be grateful. I'll take it with both hands. So thanks so much to everyone for joining. Thanks for the comments. Oh, I'm sorry, I'm seeing another question. Could you consider a proposal pack or membership FAQ? So we can use that in business discussions and decision-making in terms of membership. Yes. So we do have some documents that we have already, which we'll send out. So we've the code of conduct, the policy concept documents, as well as these slides will be made available. I'll send them all out to everyone in the course of today. So yes, thank you so much to everyone for joining. I don't know if we want to close with singing happy birthday to rare diseases. We can. I'm not sure how everyone sounds so early in the morning. But just a big thank you for being with us. Thank you for partnering with us over the last 11 years. And we're certainly looking forward to coming back stronger and most importantly, making some real change for the lives of our patients. We want, these patients are very, very important to us. And we want to be able to ensure that they get access to absolutely everything that they need. But we need our partners to be able to do that. So thanks so much, everyone. I hope you have a fantastic day. And we look forward to your comments, and feel free to pop us an email with any further items that require engagement. Thank you so much. Bye.